So I'm going to just kind of bridge into our last part of the interview is, what is trauma-informed care before then we move into, talking about how pediatricians can support families.
So, trauma informed care is a lens, just like you said. It's a way of approaching working with others. So, it can be applied in primary care, it can be applied in all across medicine, it can be applied in childcare settings, in schools, in workplaces, right? It's really useful in the business community, in the education community, in the health community, and really everywhere. It's a lens to say not what's wrong with you, but what happened to you if you're having some um, trouble concentrating, if you're having anxiety issues, if you're having anger issues, if you're not performing well in school, if there's something going on with you, instead of blaming and shaming the person by saying, what is wrong with you? You're a weirdo. Why are you acting that way? I don't like it. Like there's a problem with you as a person. And it rewinds all of that and it says, actually, when people behave that way, it's because probably something really terrible happened to them, right? It explains like almost all of the bullies of the world, right? The insecure bullies of the world are acting that way because something bad has happened to them in their life and nobody has helped them, right? And so it's not a pity party. It's not a like, oh, I'm sure that like you must have been abused. It's not a view of any of that. It's just saying, I'm actually going to try and understand you
Yep.
and help you and support you rather than blame you, shame you, or just not like you very well, right? So this
Mhm.
applies to our patients quite often, right? So if a patient comes in and they're struggling, it's important to just have that lens to say maybe there's something in their past that has happened to them that requires me to dig deeper, that requires me to have sensitivity to their needs, or requires maybe me to refer them to some type of therapy. So that's part of it. And the other important part of trauma informed care is not just saying what's wrong with you. The newer way of looking at it is also to say, what's strong with you? Like what are the things about you that are going well, that you love about yourself? So there's definitely the lens of like making sure you're thinking that this person could have had something happen to them to explain what's going on, but also that that's not defining them.